optimizing your content for different channels, and then like really understanding who you're talking to, like meeting people where they are, using the right messengers, knowing your audience, like all of that is super important. Because sometimes I'll hear like what I think is like a pretty good message. I'm like, wow, they really distilled that down. It's a good call to action. But then I'll see like the messenger, and I'm like, if you're trying to reach like a community of color, and your messenger is like a white male, you might find he doesn't look like them, that message might not hit, even if it's a good message, right? Or like if you have a public health professional giving the message, but trust in public health right now is super low, then maybe we need to give these messages to folks out in the community, to physicians, because people trust them more than they trust public health right now.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Monique Thornton. Monique is founder and CEO of Let's Talk Public Health, a DC-based public health communications and marketing consultancy. She has over a decade of experience in public health, health communication, and behavior change. She works with organizations, professionals, and students to effectively and creatively engage with people around public health topics and issues. She conferred a Bachelor of Science in Community Health at the University of Maryland, a Master of Public Health at the George Washington University Milken Institute School of Public Health. In today's episode, you'll hear and learn more about her journey into health communication, learning about it later into her collegiate career, her journey of combining creative writing with public health and founding Let's Talk Public Health, as well as how she helps organizations and professionals in public health communication and marketing efforts, and much, much more. Once again, we have an exclusive giveaway going on for Public Health Careers podcast listeners or watchers. Be sure to subscribe if you have not as yet, and the giveaway will be for a $50 Visa gift card and at least $50 worth of the Public Health Millennial apparel. Enter through the form below in the description. All you need to do is review the podcast, screenshot that review, and upload it into the form. Additionally, you can share this podcast on your Instagram stories and screenshot that and upload it into the form as well. You will get 3 entries for every podcast review and 2 entries for every Instagram screenshot that was shared. Enter by Friday, 5th of July, end of day. I look forward to seeing your entries. And if you have not as yet, be sure to review the podcast and enjoy today's episode.
Hey, this is Monique Thornton. I am a CEO and Health Communication Pro, and you are listening to Public Health Careers.
Monique, I'm so glad to have you on the show. Welcome.
Thank you for having me.
It is my pleasure. I was very excited when I met you. Is that a year ago at this point? It's probably a year ago at this point in DC. That was a lot of fun to put a face to the work that I've seen going on, and I feel like you do a lot of great things. So looking forward to diving into your story and learning more about you.
Yeah, thanks. Same.
So tell us, how do you identify, and tell us a little about your personal background?
Yeah, I identify as a Black female. I'm a Jersey girl, grew up outside of Philadelphia. And yeah, I have kind of not always been into public health, but I knew significantly earlier than most people that like public health was going to be my jam. And I have always also been like a creative person. I've always been a writer. And I guess my career has been me like figuring out how to put those two things together.
And what sorts of creative writing did you start off doing? How did you grow like your passion around that?
Yeah, I did a lot of like short stories when I was a kid. I just always loved to like write. I was writing like soap operas for my Barbies. For real. It was like Days of Our Lives, General Hospital. Like it was, they were going through some things. Then yeah, I've always just kind of been like a reader, so I was always into like YA fiction, a lot of like sci-fi, fantasy. I also liked mysteries. Yeah.
Yeah, love it. And I'm glad that we're gonna learn more about that journey of you taking the creative side of things and then transforming it into you becoming this health communication pro. So in light of that, how are you working to inspire more creative health communication?
Well, that I started my own business because I kind of found that like working in I guess the space for health communication, you're either going to be like in-house at an like, like at a health department or at like a nonprofit or NGO that does public health work. You might do like marketing for that, agency, that organization. Or you're going to be in the consulting space where you work for a consulting company. They have a bunch of contracts for different health communication related work. From like, usually the federal level or state level. Sometimes they work with like the bigger nonprofits like Robert Wood Johnson. Um, but yeah, those are like the two ways to kind of get in. And the way that I got in was in the consulting space. And it's a great place to kind of dip your toe into like a bunch of different types of public health work because these companies tend to have a bunch of different contracts. So when I was doing health communication work in that space, I was like, well, I like the flexibility. I like working on different things rather than like being in-house somewhere. But like, I also knew like working with the federal government can be very restrictive. It's very bureaucratic. There are a lot of levels of clearance that content has to go through, and that can really just like suck the creativity out of creating. And so I found that like, having to get things approved and write things like 6 weeks in advance, I'm like, how can we be timely if I'm writing these posts 6 weeks in advance? What's going on here? And so I was like, all right, I want to create something on my own that where I can have a little bit more flexibility with like who I'm working with, and have more agency over that, and be able to kind of not just like branch out in terms of different types of clients, but also just like I want to work with the more like non-traditional. I want to be like working with museums. I want to be working with like artists, muralists, writers, songwriters. Like I have so many visions of like where I want to go with this. So the first step was like, all right, let me start. Let's talk public health. Let me start a company, get this set up, start making money, so I can remain housed and fed.
Important things.
and and then like I'm just like using this business to figure out my path and slowly work my way into being in that more creative space. And then being your own boss definitely allows you the flexibility to be able to be like, I want to work with you. No, thank you. And also just like I tried to do, and I did do Let's Talk Public Health, kind of started as a blog. Like that was my outlet while I was like working in consulting, um, before I left. And that like 9 to 5, 7 to 11 hustle was like, it was starting to kill me. Like I was like, I cannot continue on like this, especially because the 9 to 5 doesn't always stay between 9 and 5. Sometimes you're working 10-hour days. Then I come home and it's like, oh, there's all the stuff I need to do for Let's Talk Public Health. And I knew I just needed more time and I needed to dive into it. So I'm like, all right, let me lean into this. Let me work on this. Let me produce some stuff under this umbrella. So I had like a podcast as well, but it's like a serial fiction podcast, and it's a story. You're following this character after like a big tsunami has hit, and it's all about emergency preparedness. And I'm like, okay, now if I could find a way for somebody to pay me to do that work, that's where I'll try to go. But yeah, it took a little bit of me like building something of my own and then really like saying like, okay, I'm going to do this full time and try to, forge my own way so that I can do that more creative stuff, because I just wasn't seeing that work coming through the traditional, the traditional pathways.
Well, that was a lot, but I appreciate you sharing that. I think that that's good grounding for like, okay, I want to inspire more creative health communication. So how do I get into health communication spaces and then like doing that work and learning that some organizations are a lot more restrictive, a lot harder to work with, and that in itself, like being like, I want to still do this work, but I just want to have like more autonomy in choosing who I get to work with, how I get to work, and growing a business while you're doing that. Quick question about the series, the fictional educational series. What's the name of it? Where can people check it out?
It's The Disaster Diaries of Ryan Jane. You can find it on the Let's Talk Public Health website. It's a podcast, so it's available in Apple, Spotify, Amazon, all the places. And season 1 is out. I'm writing season 2 currently. I'm very excited. So crazy things are happening to these characters. But yeah, yes, please check it out.
I like this because it's like narrative writing around topics that are important, and like how do you share these stories and make it like relevant and relatable to people. So that's really cool. And you said Disaster Diaries of what's the name?
Ryan Jane.
Ryan Jane. Thank you. And when did you start let's talk public health? And I'm guessing, like, when did the blog start?
Yeah.
Yeah, tell us about that.
It was a little bit of a path. The first iteration of Let's Talk Public Health came to life at the end of 2017, but actually it wasn't called that then. It was called Escape Artist because I really just was looking for an outlet for my artistic abilities, right? And also just somewhere for like public health and art to come together. So that was like a whole vibe for a second. And then about a year into that blog, I was like, okay, if I'm going to do this as a business, I was like, one, public health needs to be in the title. Like, that's just branding 101, right? Two, I was like, all right, let me repackage this. Let me rework this. And then I kind of relaunched as Let's Talk Public Health. Started getting on social, started building that up in like 2018. And I was lucky if I got like a blog up a quarter. Like I had these grand ambitions, but like life was lifing. And I also at that time was I had just finished up my MPH, and so I was like trying to balance out like that when you first finish that MPH and because I worked and went to school, like having that free time when I did have it, when work was like staying in its lane, trying to balance like having a social life again, plus trying to build up Let's Talk Public Health, plus the 9 to 5 was a balancing act. But yeah, I kind of worked on that, after hours and on weekends. And then I was like, okay, let me like actually do the official paperwork, establish this LLC, and start making moves, so that this could be my full-time thing.
Okay, and I'll come back to that later on. Earlier on, you also shared about when you were able to do, I think it was maybe like early consulting or work with different government organizations. You were able to do different types of work, and that was something that you enjoyed about the role. When you say different types of work, is that different topic areas that you're able to communicate on, or tell us if I'm going down the right path or not?
Yeah. No, you are. Yes and yes. Like working in the consulting space, where I was at, they had so many different contracts related to public health. So when I got pulled in, I was working mainly on a contract with SAMHSA, producing resources and products around homelessness, substance use, like behavioral health. And once that contract ended, that was like a year into my job, like maybe like a year and a half. And they weren't going to renew it. They were sunsetting that program. Now I'm at work like, well, okay, like that contract's over. Like, what am I going to work on now? And they're like, well, here's all this other available work for you to do. And I wind up working, I think while I was there, I worked maybe like, it had to be at least 20 different projects. Some of it was doing more like evaluation based work. So I was like designing interview protocols. I was doing like cognitive interviewing. So like, are these questions actually asking what we think they are? I was doing like, lit reviews, and I did like technical assistance. So like if a grantee site needed help with part of the evaluation, they would call me and I would help them through whatever they were working on. I was doing all kind of crazy stuff, writing reports. I did some work with the National Park Service. I was all over the place. From project to project, but it was good because that allowed me to know for sure like health communication is what I want to do.
Mhm.
It actually took me a long time to get to health comm. Back when in my like undergrad years, health communication wasn't really part of like the standard, like public health curriculum. So I didn't even know that was an option until I got into my first job out of undergrad, and started doing that work with SAMHSA. That I was like, oh, like this is a thing. Like health communication is a field. Like I can write and create things and do it for public health, like and affect change. Like what? Okay. So it once I discovered it, I was like, well, before I go back and get my master's, because I knew I wanted my MPH, I was like, let me work for a couple years, see what else is out there in the public health world, um, and then figure out if I actually do want to do health comm for my MPH and continue down that track. And of course, I loved health comm, and all the other stuff I did really helped me build skills that I do use in my communication work too. I do like workshops with for like clients around branding and stuff, where all those like research skills come in handy. But nothing could compare to how happy I was when I actually got to work on health communication related projects. And so that was good for me because it just kind of solidified like, all right, yeah, this is what I want to do.
Important lessons there, and just like try to get yourself in a place where you're able to do a lot of different types of things, and then that helps you in identifying the things that you maybe like more or you like less, and then you can try to find your path in doing that. And I guess everything you just said there, I think it's a great question. Like, how does an organization more effectively engage with people around public health topics?
Yeah. Um, this is so important for so many public health related organizations, even like our federal and state agencies. Sometimes I go on their websites and I'm just like, what is this? Like, why? Why? Sometimes you go in there and it looks like you're looking at like Windows 95. Like, when was the last time y'all updated this? Why
Right.
is this so hard to use? What are we doing? Or like I'll be on social media and I'll see like I'll see something like an image pop up and there's like 15 lines of text on the image and I'm like, who can read this? Guys, come on. No, 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 no. I I think the most important thing is like one is understanding like all of like the digital communication landscape, understanding like what a good website looks like, understanding like where you need to be on which platforms and where you need to be doing what. Like that's like step zero. Optimizing your content for different channels, and then like really understanding who you're talking to, like meeting people where they are, using the right messengers, knowing your audience, like all of that is super important. Because sometimes I'll hear like what I think is like a pretty good message. I'm like, oh, they really distilled that down. It's a good call to action. But then I'll see like the messenger, and I'm like, if you're trying to reach like a community of color and your messenger is like a white male, you might find if he doesn't look like them, that message might not hit, even if it's a good message, right? Or like if you have a public health professional giving the message, but trust in public health right now is super low, then maybe we need to give these messages to folks out in the community, to physicians, because people trust them more than they trust public health right now, so that they're actually in a position to receive those messages, you know? It's like all the pieces kind of need to be in place. And sometimes I see some of the pieces there, but not all of them. And like all of our information, the way that we come in contact with information these days is all through algorithms. So if your content isn't optimized to work in those algorithms, like you're not going to be reaching people. And it wouldn't be so important if our field wasn't about like saving lives. Like public health saves lives. And when we're not optimizing our content, when we're not getting creative and really trying to package things in a way that's going to be desirable to people, we miss out on getting them crucial information, and that's costing lives. And yeah, so it's about understanding communication landscape, understanding how to optimize content, and then packaging things in a way that's actually going to be like interesting and like attractive to people. And I think we struggle with that. So like even we'll have a good message, but I'm like, okay, but like you needed a different that the look and feel is not young enough for the audience you're trying to reach, or it's just those little things. But when those things align, it just it gives our messages, it gives the information we're presenting, it's like best chance at actually like hitting with folks. And that's what we need.
You definitely have to cover the basics of understanding who, like, first of all, I guess, what is the goal, and then like outlining who are the people that they're trying to reach, and then who are the people that are trying to be reached from that. And everything you said makes sense, and it's like a branding kind of like 101, and thinking about how do you market yourself to share the information in the right places. And it all comes back to like the avatar and thinking about, okay, who am I trying to save, then where are the right places to reach that person and really get that message across in the right way to get whatever that change is you're trying to receive. So that's some awesome insights, and I appreciate you sharing that. And you shared a lot about public health and how you were looking for like a path in public health and communication. So what does public health mean to you?
It is, you just posted this. I think I saw it on LinkedIn. It's either LinkedIn or Instagram, but like public health really is a calling. Anytime I'm like interviewing interns for our experiential learning program and fellows, and I'm like talking to them, I always ask them like, how'd you get here? What was your path? Why public health? It's always the same. Like people are like, yeah, I just wanted to like help people. I wanted to like leave the world better off than I found it. I feel like just certain types of people are drawn to public health. And I also think it's like a way of life. It's hard to go through an undergrad or graduate public health program and not be like moved to make changes when you really understand like all of the factors and determinants that are affecting people's health outcomes and how you could be contributing to those things. I feel like it makes you kind of switch up a little bit. Like I feel like we're a little bit more environmentally conscious than the general public. We're out here fighting for social justice issues and causes more than maybe the general population, because we kind of understand and see how all of these things are interacting in a way that like other areas of study and other like majors and fields like just don't.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career-boosting events, connect with like-minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in the description, and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. And you shared earlier that you knew about public health like for most of your life, and then now you're sharing that like public health is a way of life. You got your Bachelor's of Science degree in community health at University of Maryland. Tell us about learning about public health and then the thought process of going in for this degree.
Yeah. Like I said earlier, I'm nerdy. I like to read. So of course, since like since before, I guess like that's a generalization, but I really do think it is true. Like before the pandemic, people really didn't know what public health was. Uh, we never
Fair
seem to
statement.
like, we never seem to be on people's radars until something horrific's going on. We're never
Mhm.
like telling them all of our wins. They never see us
Mhm.
when the things are working because nothing's happening, right? Like people aren't dying. So of course, like I had never heard about it. I was reading this 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 young adult fiction novel. It was called Code Orange. It was about a smallpox terrorist plot in New York City and a teenager who gets caught up in it. And just a random book I picked from the library. But because it was about, I had this like smallpox storyline, it mentioned CDC. It was like talking about epidemiology. And I was like in 8th grade, I'm like reading this book and I'm like, what is the CDC? What is epidemiology? Like I like remember like going into the school library after school and like Googling like CDC epidemiology, like what is this? And like starting like reading and being like, oh my God, there's this whole field. Like, like I was one of those kids who I knew pretty early on. I was like, oh yeah, I'm probably just gonna be a doctor. Like I just want to help people. Like that by the 8th grade I was there. But then when I read about public health, I was like, bet, like we can help people before they even get sick. Like that makes so much sense to me. Why doesn't everybody know about this? Like I asked my mom, like, do you know about this? She was like, no. My teachers didn't know. Like I
Mhm.
was like, okay, well, this is what I want to do. And so yeah, so since 8th grade I knew. So in high school, like, I'm taking on my like science. I took like extra science courses because I'm like, all right, I know this is where I'm gonna go. And when I was looking for my like bachelor's programs, I only applied to colleges that had accredited schools of public health. Like I was serious. I was like, we're gonna go to the best of the best. And yeah, so Maryland was one of the schools on that list. I got a full ride there, so of course, like hell yeah, I was gonna go. But yeah, that was the path. But I know for most people, um, they don't discover public health and usually until college, when they're usually like pre-med or like bio or chem majors, and then they get to like a certain level of coursework and they're like, wait, this is too much. Like, no, is there something else I can do? And then they discover public health and they're like, oh, this is what I wanted all along. So
It's that organic chemistry 2 class.
that or go. I had roommates and I remember them because they were all pre-dent, pre-med. And I just remember them like all on the floor with those like
Mhm.
the little rods with the in there
The
building
3D
chemical
things.
structure.
Yeah.
I was like, good luck with that. Bye, y'all.
I will let y'all know that I got a solid C in my Orgo 2 class. So just if anyone was wondering. But yeah, Orgo 2 is hard. But that's truly awesome. Like shout out to you for like finding this book Code Orange and then learning about public health and like public health concepts, and then even going even further to like ask, hey mom, do you know about this? Hey teachers, do you know about this? And I think that is what we need more of, and that's why like I'm a huge advocate of the podcast that you have as well, because I think it also introduces public health topics to people in a way that is just kind of like relatable, and that's what we need more of. And to your
Yeah.
point, it's really hard, or at least historically, public health has done a very bad job of like sharing the wins, sharing what they're doing when we're outside of a crisis. To your point, so
Yes.
yeah. But that's awesome. That's awesome.
Thanks.
And shout out to Full Rides.
Shoot, look. I mean, like sidebar for a second, like I was enamored with Hopkins. Like you could not tell me I wasn't going to Hopkins. And I got in and I that was where I was gonna go for a minute. But then when the scholarship opportunity came up and I went to interview at Maryland for that, and I remember having a conversation with my guidance counselor and I'm being like, but Hopkins is the number one school. Like Hopkins is like having that like name behind my weight, that weight behind my, my name, and being able to say I went to Hopkins for public health. Like, and she was like, how are you gonna pay for that? I was like, well, I'm just gonna take out loans. She was like, why would you pay for loans? She like broke it down for me. She was like, for real. She was like, you're planning on getting a master's anyway. I was like, yeah, eventually. She was like, ain't nobody gonna care about that bachelor's when you have your master's. And she was like, and Maryland is a good school anyway. Why would you not go there? Like, why would you accrue all this debt? And I'm like, yeah, you're right. So yeah, when I came through, I was like, oh yeah, like, okay, I'm here, let's go. And honestly, like, those 4 years at Maryland, I met so many good people, so many great opportunities came out of that. Like, I loved it. I loved it so much. So like, I think sometimes we get pressed on like, my path has to be this, or I have to do that, or you have this image you build up in your mind about what your milestones are going to look like, and you just got to go with the flow, and you just got to pivot. And the great thing about public health is we have the most pivotable degree ever. Public health touches almost every other like industry and field out there, so you can really move with so much more flexibility than people from like other, like degree programs. Yeah, so I'd be like, don't be pressed about that.
Shout out to that counselor for breaking that down, because that makes a lot of sense, especially considering that if you do know that you want to get a master's of public health after your bachelor's, it's a lot harder to get that paid for. So just understanding, like, going into that with the least amount of, and just having the least amount of debt is very, very helpful, and it takes a lot off of you in a lot of ways.
Because I'm still those student loans from my MPH, they haunt me.
Understandably.
That is so real.
Understandably. So while you were in University of Maryland, tell us about any experiences that you wanted to highlight throughout that time.
This kind of speaks to like what we were just talking about, but like, when I first got to Maryland, like, in my mind, I was like, I'm gonna be an epidemiologist. I'm gonna be out here investigating outbreaks. Like, that was the vision I went in to the program with. And I had been reading, like, all of the nerdy public health books, The Hot Zone, just about like Ebola, Demon in the Freezer, which is more about smallpox. I'm reading all these books and I'm thinking, like, that's going to be it. Like, I'm going to be out here. I'm going to be in the CDC Epidemic Intelligence Service. Like, I'm going to be out here with the BSL-4 suit on. Like, I really thought I was so set. Like, that was the picture I had in my mind about what I was going to be doing. And when I got to Maryland, I started learning about all the like chronic, like the chronic disease side that I never paid attention to. Like, I was so focused on infectious diseases. And then you start learning about like social determinants of health. And you start seeing like, oh, like, this is all messed up. It's being impacted by all these other things outside of our control. And then I was like, okay, I started feeling this shift happening. Like, okay, maybe I don't want to be in a lab or be like out in the field collecting samples and in the lab studying petri dishes and pipetting and doing all that stuff. Like maybe I actually like want to be doing more work in the community. And working on some of this stuff that's like super changeable. Like, we can fix this. This is fixable. Like, I think I want to get in here. And so I think that for me was like a huge like flip of the switch. Like, I was like, oh, wow. Like, okay, I'm going to shift here. Like, I'm actually, I'm going to go this way now. And I feel like that program just really like trained you to be like a good like community, like a health educator and like a program director. When I graduated, like, I could design a program, I could run the evaluation of it. Like, I knew all the things. I felt like prepared. I'm like, okay, I'm ready to like figure out this next step. And still at that point, I still had no idea about health communication. Yeah. I was like thinking I was gonna be like, creating health education programs. So some part of health communication, but not in the way that I'm envisioning it now. And funny note was like, I took a fiction workshop as an elective my junior year of undergrad. Yeah, like the second semester of my junior year. And it was a short story. So you wrote two short stories, and then like you would share them with the class. Everybody would read them and give you feedback, and you workshop them. And I took that course, and for a whole second, I was really about to be like, you know what? Actually, I want to switch my major to creative writing. like I kind of had put the creative writing on pause and was focusing more on like, all right, let me figure out these anatomy labs. The things used to kill me. Like they put the sticker on the bone, and they're like, "What's the bone?" It was like, oh my gosh. So I was in that headspace, right? And this fiction workshop kind of reminded me like, oh, but I have this whole other side of my brain that I also love like using. And I knew it was too late. I was like, I can't just switch. I got too many, it would be too many credits. Like, I can't just switch. They're not going to pay for that. Like, let me just finish up my public health degree. But I really, in my mind, was like starting to get that sense like there has to be a way where I can take this creative writing and the public health and health education and health communicate, like the health education, and put them together. And so that was kind of brewing. And I thought maybe I might wind up like going to grad school for an MFA. I did look at those programs while I was also looking at MPH programs. But ultimately, like, I think I made a good choice.
Well, I'm glad that you were able to share that and like kind of just unpack the journey of what it might look like for someone, and like to the point of like you never know where you're going to end up, or like what experiences while you're developing are going to really like stand out for you and just like be yeah, so I appreciate, really appreciate you sharing that, as well as I love the MFA. I've had someone with an MFA on the podcast before, and he does a lot of art around like public health, health equity type stuff. Derek, so shout out to him, and but also glad that you're able to do the MPH, so we could talk more about like how you're able to figure all of that out. But that's awesome, and you sharing that story maybe let's realize like there's a lot of writing, because you've read a lot of like fiction books, so like real books about stories, and they're many times about infectious diseases. It's kind of hard to write interesting book about chronic diseases.
Yeah.
So it makes sense that it just wasn't in your face as much, or like maybe not in the same respects as like reading and diving into those stories, which is an interesting concept to think about. And I think about the pandemic as well, as in like epidemiologists being at the forefront of what people understand public health is. So maybe we need to do a little bit more as well to share more about the chronic diseases and how that really plays into to public health as well.
Yeah, agreed.
And before we move on to you graduating from undergrad, were there any undergrad takeaways you wanted to share?
Just like keep an open mind. That's it. Keep an open mind, and you'll never know where you'll end up, even if you're not specifically in the public health field. Once you get that degree, you'll be using it. It's just relevant to so much that goes on in the world. So
yeah, and to that point you shared earlier, like the skill sets that you gain from public health are applicable to so many different fields and can be used in so many different ways. And I think it just gives you a perspective and a lens that is very valuable to a lot of work that goes on in the world. So definitely understand that, as well as, yeah, absolutely keep an open mind. So you're sharing, you went into undergrad thinking epidemiologist, you're learning more about, oh, I want to do maybe like more chronic disease, health education type stuff. So it seemed like the first job that I have for you is as a digital and social media associate at Westat. How did that come about? And then tell us what you did in that position.
Yeah, it actually started as an internship. So another plug is don't be all in your books only in undergrad. I was working on a research project, just like on the side. Like I wasn't even getting credit for it. I just knew they had this research going on. And they were looking for research assistants. So I was like, let me add this to my resume. And it was actually one of the professors that was working on the project there at Maryland that was like, oh, like, I think you'd be a good fit for this internship program at my job, like her 9 to 5. And I was like, oh, okay, sure. So I applied. I applied to that. And then I applied to CDC's Public Health Associates program. Those were like my my two main. If one of them didn't pan out, I don't know where I was gonna be working. It just crept up on me senior year. I don't know. I was like a little burnt out, and like all of a sudden I'm like, oh my God, like what am I doing after graduation? Like I gotta get a job. So I applied to that. Those two things. And I did make it to the second round of interviews for the CDC program, but I ultimately wasn't picked. But I heard back from Westat and they were like, yeah, come on over. So I'm like, okay. So that internship was my first exposure to like health comm in the way that I think about it now. One of the things we worked on that SAMHSA project was we were going around the country and like interviewing folks at different like homeless shelters and like supported employment and education programs for folks who were either previously homeless or were that had like substance use disorders. And just like I remember like first like us like coming up with the questions like how are we going to interview these folks, and just hearing their stories and like seeing all the different ways we were able to take those stories and create video and create like print products. And that was when I was like, hold on. It's like, I like this. Like, this isn't your standard, like, I'm going to go in here and create a diabetes program and run my intervention. And, you know, like, I was like, this is where it's at. Like, this is what I want to be doing. Like, this storytelling, like, what? You can do this? Like, I don't know. My brain just never connected the dots. Like, oh, this is a thing. Like, I could do this way. And that was just like a big eye opener for me. And then like Westat hired me. So I was an intern for like a year and change. And then they hired me for like a regular employee position. And the contract I was working on ended. And then I was like panicking. So I was like, no, I like that work. But then, like I said, I got to kind of play the field and figure out what I wanted to be doing. And that time at Westat, like the experience that you get from being able to work on different projects, but also like the exposure you get. I made so many contacts in so many different federal agencies. And I think that was just good exposure for me. Cause now that I'm like where I'm at now, I'm like, oh, it's good that I know some people that they recognize my name for the work that I did. It was just like good to be able to work with different agencies, kind of get a feel, at least from the like one small team within that agency I was working with, about like the work that they were doing. I mean, it just kind of opened my eyes to the public health landscape. For so long, I had thought like local health departments. That was kind of my exposure. I interned during college at like my local Board of Social Services and my local health department back in Jersey. And that was kind of my thinking, that and like CDC. But I started like really, you start learning about all these agencies in undergrad. And then I got to actually kind of work with all of them and like learn all their different missions and kind of get a understanding of how most of the money that's in public health in this country is coming through the feds. It's linked, even if it's a state grant, the state probably got it from the federal government. So understanding that landscape and understanding like, okay, like how do we navigate this? How do we know where the funds are, understand the type of work that's out there, how the government is like picking its priorities and assessing need and determining where money goes. It's you think it's kind of ancillary, but it really is the like crux of the work that we do, because especially in consulting, we can only go after the contracts that are written and put out there for us to go after. So it was kind of eye-opening in a different way to see things, to see it through like the private sector side of it and how these companies fit in. And you really learn that like a lot of the work that's put out by the federal government is done by contractors. And that was also very eye-opening to me too. It was just a really good learning experience, a good way to network. And like I said before, like a really great way to just try different pieces and parts of public health and kind of figure out what I liked and didn't like.
really sounds like that opportunity broadened your perspectives on what public health could look like, as well as gave you a better understanding of like what the actual federal to state to public health landscape looks like. Because yes, all the things you say are very, very true. And I guess so. You're learning that this health communication thing is something that you can actually do with public health. You're learning that these federal agencies are getting work and you're supporting work for various different types of things. What was the thought process in pursuing your master's of public health, where you got it at George Washington University Milken Institute School of Public Health?
Yeah. Um, so by the time I was like looking at programs, I knew I was like, okay, health communication is going to be my focus. Like that's going to be my concentration. That eliminated a lot of programs. I was like, I only want things that are specific to health communication. Um, and it was kind of interesting too, because I had originally looked like at MPH programs, but then I realized there sometimes health communication programs aren't in the School of Public Health at a university. Sometimes it's in like the like arts humanities school. So that was interesting, like looking at the difference in the curriculums based off of what college, like whether it was in a School of Public Health or a different college. Or just like understanding I could get my MPH, I could get a master's of science. So just and a master's of science in public health, like I was like, oh, there's all these different degrees. So I kind of broadened my net a little bit in that light. And really at the end of the day, it just came down to me like literally looking at like the courses available and being like, do these cover all the things that I understand right now, to be important to health communication and marketing. And I just felt like Milken's program hit, it checked all my boxes. And also at the end of the day, it's a money thing. Like you said, there was nobody knocking at my door trying to give me a full ride for a master's degree. Like that didn't happen. So when I was deciding about these schools, I was trying to do it in a holistic way. Like first, let me make sure the program is dotting the I's and crossing the T's, and that I'm going to be in a great position when I graduate with all this debt. Two was like, let me be real about like the vision of my life outside of just this program. Like I'm a person, I'm not just a robot. I'm like a whole woman. Like I want to have like, I had this like vision in my mind. I'm going to be like this metropolitan woman. I'm going to be in the city. Like College Park was more of like a college town. I was ready for like my like grown and in the city life. And so I was looking at programs that were in schools that were located in cities. I'm looking for health communication specifically. I had a little spreadsheet, like what's the cost of living? How much would my rent be? Like, I was like, we need to understand what life is going to be like, because this is going to be the next 2 years of my life. Like I want to make sure I pick somewhere where one, the program's good, two, like I actually like the location, and then I can like actually afford to like live there and still have somewhat of a life that I can squeeze in while I'm in school and working, because like, there was no way I could do school and not work. That wasn't an option. And yeah, I even like made it a point to visit all of the schools. Like we're gonna see this campus. I don't care if I got to hitchhike. We're gonna make sure that we want to be here for the next 2 years of our life. And yeah, like no place hit like DC hit, man. Like, and I mean, I had been in the area like after I graduated from Maryland. Westat's located in Rockville, so College Park is like over here. Rockville's like right there. So I had been in the Maryland area, but I didn't really come into DC like that. So like it all just kind of worked out perfectly, because as soon as I like went into like, I remember driving into the city and being all like nervous, like, oh my God, I never drive into the city. Like, oh my God, what's gonna happen? I'm like, we gotta go, we gotta check it out, we gotta scope out the campus and make sure we like it. And I just, as soon as I like parked my car in that parallel parking, I parked my car, I get out, and I was just like walking around. I'm like, yeah, this is it. This is it. Like I knew. I was like, it's done. Like this is good. And it worked out. Like I had a great time there. I'm still in contact with several people from my cohort. We all follow each other on various social media. A lot of them now have had kids, gotten married. Like, it was just such a good experience, and the program really did like cover all of the things like I felt like we needed to be talking about in public health. Minus the super technical skills. That's my only beef with a lot of these programs is, you might, design a program and walk through all the steps for like a class project, but rarely ever do you actually like have the funds to implement it. They're not showing you how to actually do the nitty gritty. But besides that, yeah, like it was good. I was getting the nitty gritty experience at work, so it worked out well.
Fair enough, and definitely rewind that if you're thinking about like MPH programs and to get a better idea, like what are some things that you should think about, school wise as well as like city wise or town wise, like just understanding all those factors to really know what you're getting yourself into. Because as you said, it is an investment in the next 2 years, 2 years plus for some people of your life. So really thinking about that and really ensuring that it is the place that you want to be and you want to get that degree. And like to your point as well, like knowing that I want to get a job afterwards. How is this gonna help me get that job? Because that's something I think a lot of people don't maybe think through as intentionally as they should.
Yeah, definitely.
Were there any experiences you wanted to highlight?
Yeah, I took a course outside of the School of Public Health. This was like, I didn't even realize how much of a game changer it was going to be until I did it. But there was a school in the class in the business school that was integrated marketing communications. And it lined up with my schedule. And I was like, can I use this as one of my electives? And my advisor was like, I don't see why not. He put the paperwork through and they were like, yeah, you could take it. And I'm like, all right, great. And I just remember I'm in this, I'm like in a different part of campus. I'm like, okay. I'm like, wow, I've never been in this building. I had no reason to be in this building. I'm like, all right. Go in there the first day, and the vibe of me, this public health person, being in a room with a bunch of like MBAs, it was just such a stark contrast. Like,
Mm.
like I remember that first day like of the course, we're like going around the room and introducing ourselves and talking about our goals, and everybody's like, yeah, I'm gonna start a company and I'm gonna make $1 million. I was like, oh wow. I was like, oh, I was like, this is just a totally different energy than public health. Like public health, everybody's like, I just want to make a difference. I'm gonna, start a nonprofit in my community of working on this, addressing these issues. These people were like, I'm about to build the next Fortune 500. I was like, wow, it was just such different energy, but it was so good for me because one, it got me like thinking more business minded. And two, like a lot of the tactics, like the commercial marketing space is just so much more creative than the public health marketing space. And we need to be learning from them. So it was great for me to be in this class because I felt like I got to be a little bit more creative in the, campaigns we were designing for projects and stuff. Like we just had more flexibility and we were looking at commercial case studies instead of like, like social marketing. We're looking at the for-profit marketing. And it was just like it was great for me to be around that energy and to have and build that perspective because I use that when I'm looking at, when I'm like in the work that I'm doing now. I'm always like merging. I'm like, what are the cool things that the for-profit world is doing that we can translate into public health so that we're not so stale? So yeah, it was good.
That's absolutely true, and I think that's good to be able to get outside of like your comfort zone and be around people that change your maybe limiting beliefs or your perception on the
Yeah.
world or how they are viewing the world. Just makes you think a little bit more deeply. And I definitely think there's so much that public health can learn from private companies and just how they do their marketing and their communications and how can we like take these innovations and really build it in. And one thing that I do like regret is like you said, there is always a possibility when you're in a master's program to do coursework at colleges that are outside of the college that you're in. And if you are able to do that, like definitely flex that skill, because you never know what that's going to do, how that's going to expand your mind and really like set you apart from other people. So appreciate you bringing that up, and shout out to you for taking that opportunity and being in that space.
Yeah.
So did you have any takeaways from your MPH you wanted to share with us?
Yeah, just like connect with the people that are there. Consider all the factors before you make your choice and decide where you want to go. And then once you're there, like actually connect with people, because like those really are your peers. Like those are going to be who you're potentially going to be working with when you're in whatever job you get to. And I think sometimes we sleep on that. We're so focused on networking up, but we forget the horizontal parallel. Is it horizontal parallel networking?
I
There's
think
like a term for it, but you know what I'm saying, right? Like don't
either
miss that on
works.
this. Because it's these people that are going to be coming up with you too. And the more that you can have connections in different places and be able to tap into those networks, if you're looking for like, to change jobs, or even just like in the consulting space, like knowing someone somewhere else is like great, because I'm like, all right, what's going on over there? Maybe I need to hop to the next company, get a little pay bump. Yeah.
Yeah, definitely very helpful. And I think, as you said, it is something that we do underutilize, is having those good, robust relationships with people that are in our core, because you never know where someone is going to end up and how that can help you. So also be kind in all regards. So you graduated from your MPH and you worked as a digital media consultant at Bekôz Marketing. So tell us about that experience.
That is just some freelance work. I had a friend who, it's her business, and she pulled me in to a couple of her contracts, and that experience was just so good for me. I actually worked with Bekôz I started working with them after I graduated undergrad. So in the 2 years I worked before my MPH and even during my MPH. And I think that was a good experience for me because I got to see like a small business at work, like seeing someone else that I know who looks like me, that has somewhat of a similar background to me, seeing her like succeeding in her business and seeing that she built something really made it feel like I could do it. Um, and that was just like a good experience to having someone. Um, she's very much a mentor to me. And fun fact, when I was first conceptualizing what would become Let's Talk Public Health, I worked with her. She took me through the process that she goes through with her clients, and helped me kind of like massage out my vision. And yeah, just like meeting her, going through her process and like helping me figure out what I wanted to do. And also just like seeing a small business at work kind of like helped me like get the stones to be like, okay, I can do this too.
Well, that's awesome that you were able to get that opportunity. 'Cause not many people are able to. I think, and especially in like small businesses, because you're just able to interact with so many different things and learn like the business side. Because similarly, I'm guessing throughout your MPH program, you didn't learn much about starting a business and growing a business
No.
and doing that, because it's not something that they teach us.
Nope.
So having that experience, I think, is helpful. And I also like the name because I didn't know that was how it was pronounced.
Yeah. It's like the phonetic spelling, because the,
Okay.
the clients they work with are all do work in the social good space. They'd like to do marketing for businesses and organizations that are having a positive social impact.
That's awesome.
Yeah.
So I'll ask you about this award, and then we'll talk a little bit more about Let's Talk Public Health. So your Public Health Engaging and Emerging Leaders Awardee. Tell us about that.
That was really it's gonna sound funny when I say it, but that was really me like getting over myself, because I will say what I mean by that. Even though I I think I come off extroverted. I am actually quite introverted. I'm an extroverted introvert. Like I can be extroverted, but then I need my me time, right? I need to like recharge. I'm like, okay, y'all need to go away now. I'm done. And that makes it hard for me to like be self-promotional. Like I always feel icky. I don't know why. I just like I should be humble. I shouldn't talk about what I do or be braggadocious or whatever, but um you really do need to promote yourself. Especially if you're going to start your own business, like you cannot get around it. Like you have to get over that shyness, and you have to be able to put yourself out there. And this award is an example of that. Like I knew I would need to think about like what are some PR strategies I can use for Let's Talk Public Health. And one thing that came up was, like going after awards. I was like, okay. So I started looking like what public health awards or like marketing awards do I think I could qualify for and potentially win. And when I saw Maryland, I'm like, okay, that's my like alma mater. Like, of course, like I'm gonna go after this award and I'm gonna nominate myself. And even like a couple years ago, I might have felt icky, like, why would I nominate myself? Like, someone should nominate me. But then I'm like, who? Of all the busy people I know that are working 9 to 5s, got multiple side hustles, we're all out here grinding. Who's gonna have the time to nominate me? Like, and then who's gonna know how to fill out that nomination form better than me? Because I'm the person it's about, So that was me getting over myself and being like, you're gonna nominate yourself for these awards. Like it says self-nominations are accepted. So you are gonna self-nominate. So I did. I'm like, you aren't gonna win awards if you don't put your name in the hat. So that was me getting over myself and starting to put my name in hats where I thought I stood a chance. And it worked.
Love that, and I think that's an important message because we have to be our biggest advocates in whatever we do, and like to that point, self-nominate yourself, share things with people, even when it does feel icky, because you if you don't do it, you're just going to be in the same position
Yep.
that you are, and I think it might be an issue that stems like broadly from public health. Like, it's good people should just like know about it, or I don't know.
Yeah.
I don't know if that's just coming off wrong or whatnot. But regardless, whatever you're doing, like promote yourself. Do it.
Yeah.
I don't do it enough, I would say as well. But neither here nor there. I appreciate you sharing that, and shout out to you for winning that. Glad that you're able to do that. So you're the CEO and founder at Let's Talk Public Health. We spoke a little bit about maybe tell us more about the process of you like getting maybe your first couple contracts and how that formed out.
Yeah. So I just I'll take y'all to what year was that? 2021. Yes. So it's coming toward the end of 2021. It's like fall. And at this time I'm still at Westat. Public health is a nice flourishing blog. The website looks good. I'm like happy with the branding. Everything is where I want it. Earlier that year, I like went through the LLC like process to make it like an official business. And I did that, but I had no intention of actually doing it like full time. Like I wasn't gonna like go all in. But by like September of that year, I was just like, I was feeling so disconnected from my work. And it was nothing about Westat. Like I loved it there. I loved the people there. It was just like I knew that I wanted to be doing slightly different things. The same thing, but with like different clients. And I wanted more flexibility. And up until that point, I had been able to kind of just like push those feelings aside and keep on doing the grind. But at the end of that year, like I got to a point where I couldn't anymore. I couldn't pretend that I was feeling like something was missing. And I also just knew Let's Talk Public Health needed more of my time than was available because I had this 9 to 5 and I was still freelancing. So I was like, okay, like something's got to give. And I was like, all right, let me let me just do this. I was like, what if I quit my job and do this business full time? I was like, all right, let me look. I'm like, okay, I got a little bit in savings. I was like, we can test this out for a couple months, and then if it doesn't work, I can just get another job. Like I had no, I mean, the job market also was a little different back then than it is now, but I had no doubt in my mind that I could go to any of Westat's competitors and would get picked up very easily. So I was like, okay, like we're gonna do this. I'm gonna do this full time. Of course, when I had that conversation with my mom, she's like, you're gonna quit your full time job to do something where you have no clients or anything lined up. I was like, yes. It was like, maybe take some time to think this through. But yeah, so that's I was at that point. I was like, okay, I'm gonna do it. I put in my 2 weeks notice. Well, actually, I stayed in through to the end of the year. So I actually gave them like a 3-month notice. And it gave me enough time to like transition all my work and leave Westat like in a good place. And at that time, like I was like, okay, like now we got to be forward thinking. Like while I'm transitioning off my projects at my 9 to 5, I got to really start thinking through like, who am I going to work with? How am I going to make money? I need to think like I need to start marketing. I need to get the word out there. I need to like feel out all these connections that I've made, and start reaching out to people and putting my name out there. And the good thing was like by the time I had left Westat, I was I had been pulled on to help write some proposals for them. I was at that stage in my career at the company where I was working on doing proposal writing. Nothing crazy, but like it was good exposure because I was like, okay, now I need to go after proposals like that. I have to write these things now, and I have to go after my work, or I will be making no money. And so I think that was good for me because I used those skills to be able to be like, okay, I have a good understanding of this market. I worked on it at a bigger company before. Now I'm one of the smaller companies, but I understand how all the pieces work. I understand like, okay, this is where I can look for contracts. This is where I can look for like RFPs that are out and how to put together a proposal. And so having gotten some of that experience, I could translate that into my business and start going after work, and going after contracts. And like I'll say like 80% of it, of the work that I have had so far is mostly because I had connections somewhere. Like I knew somebody. So they were like, oh, like, my company just put out a request for proposals, or did you, or they like knew, they had heard of work that was relevant to what I was doing because they're in the space. So they're like, oh, I just saw a proposal come out. I think that would be really good for your company. And people would just send me stuff. So it was like that network of support that was really good for me. Because I wasn't like on my own. I wasn't alone. I had like a nice buffer, and a nice like support system. And then I was still freelancing. So I'm like, okay, let me know if you got any work over there at your company while I'm building my company. And yeah, all of that allowed me to be able to like continue doing Let's Talk Public Health full time. I'm not gonna sit here and lie to you. Like I'm by no means balling. My credit card debt has like tripled since I started this, because I got to make up the gap somewhere. And it's by no means like flowers and honey. It's work. Sometimes things can get really tight. Like financially, and you're like, oh my god, like am I going to get another contract? It can be very stressful. But on the flip side, the autonomy that comes from it, the being able to build something, being able to build a company the way I want a company to run, that's also been really important for me. Just creating opportunities, creating an internship and fellowship program for students, just like building a team, that's probably a lot younger than it is a lot younger than the typical C-suite's going to be. Like I'm a CEO, but I'm like in my early 30s. So we're learning. We're like building the plane while we fly it. But it's been fun, and it's been liberating, and at the same time frustrating and very scary sometimes. But you keep moving forward. Yeah.
Appreciate the transparency and the openness in that. And I think a lot of the keys that you're sharing in you taking this jump into starting your own business, becoming your own boss, becoming an entrepreneur is like really, firstly, it sounds like you built out your brand and the things that you were doing just at the companies that you were at before, from Westat to the I don't have the name right now, where you're helping your friend
Oh, because
because
yeah,
because
yeah.
marketing, as well as just learning all those different parts of like what a business looks like. I think is so important, and it's hard. It's like it's hard work. It's hard work, and in a lot of ways. So firstly, like kudos to you for like taking that um chance on yourself and like diving deep into this hard work. And while also it being hard, I can imagine all the rewarding things. And like I guess thinking back or thinking on the experience of starting this business and doing the work that you have done, what would you say is the most important thing that you've done for your business?
That's a good one. Um, the most important thing I've done for my business. You mean like project wise, like client work?
However you want to take it.
Okay. Um, I think the biggest thing for me so far has been um, hiring folks. So I have two part-time people. My CMO who does my a lot of the marketing, and my CFO who is advising us on all things money related, so that we can scale up. And I think that was just like a big step for me. It's also a huge source of stress because now I have to be making enough money to pay these people and pay myself. but
Mhm.
but it's been nice having like other folks in this. And I don't know that we talk about this enough, but like starting your own business, if you're doing it on your own and you don't have like a partner that's coming in with you, can be very lonely and very isolating. Um, I'm working out of my apartment or from like a cafe, and it's just me on the computer, and that can be very isolating sometimes. And so it was great to actually have people who are in on this with me and are like invested in this vision and helping me implement all the different pieces, and also just like working with the interns and fellows that have come in. And um I love it when I see like light bulbs going off in their heads. I love it like when we have our team meeting, having all like different people on the call and they're all talking about what they're working on. I'm like, oh my God, like I did this. Like that to me has been has really been like the biggest thing. I'm like, okay, like we like sometimes you're just so focused on the next thing and like getting to the next level and reaching this
Mhm.
next milestone, and you got your head down and you're just grinding, that you forget to like take in like where you are and everything that you've done. And I just like being able to have the team, and just like being able to bounce ideas off of so many like creative and fun people, that's just been so rewarding. Um and yeah, I'm just excited to see where it goes from here and how we scale up. And I really just want to build a business that's not so hierarchical and so rigid. um, I'm very much about transparency, and non-toxicity. We don't do toxic workplace things at Let's Talk Public Health. No. um, yeah, I just like seeing that all come together has been super rewarding. And just seeing like the graphics and videos that interns put together and seeing them like being like, oh, like okay, like I understand this now, like how I distilled this message down and wrote the script, and like being able to see those dots being connected is so great. And then just being able to work with some of the newer clients I've had, and to be able to come into their organizations and be welcomed and like help support their missions. That's so rewarding too, because I really felt like when I was at Westat, like when you're working at that level and working on a federal contract and you're working at the consulting company, you can feel very removed from the impact of your work. And like, I feel like now I see the impact more. I get to even be in working in communities more when I'm helping my clients with whatever, marketing or project we're working on. So like just being able to be out and about more and like to see that more of the direct impact has also been really nice. Because I think that was a part of some of that dissatisfaction I was feeling towards the end at Westat. Was just like, okay, like I love the work that I did. I'm proud of the work I did there, but I'm feeling like the impact's a little far removed, and I'm feeling like I want to be able to be a little bit more creative. And so just like Let's Talk Public Health was just the next logical step for trying to make that happen.
Well, shout out to you and the team that you're building and the work that you're doing. And yeah, I'm glad that you took a chance on yourself and you are seeing the impact before your eyes right now. So one of the things that I use actually a lot from Let's Talk Public Health is the complete list of observances for public health communication and marketing. It's a resource that I use, Brothers in Public Health uses. What are some of the things that you do as Let's Talk Public Health when people go to your website? What are the kind of things that they can glean from you?
Yeah. That makes me so happy. That is like our top performing resource. Yeah,
It's a good one.
Yeah. I thought so. I felt like it was missing. I was like, I needed something like this. Where was this when I was at Westat? One of the things that I really wanted to do at Let's Talk Public Health was, as much as possible, to create free or at least like very inexpensive resources that could help folks with health communication and marketing. Because as we know, public health is severely underfunded. And most like health departments and like frontline organizations that are doing works on the front lines don't have the budgets to hire a marketing company. They don't. They don't have an in-house social media person. They have somebody who's doing 3 other roles, posting randomly, trying to make it work, And so I wanted to build resources to help those organizations, those smaller agencies, the ones that don't have the big budgets, to be able to do the best that they can do. And so one of those was just like going through the interwebs and pulling every observance I could find that was relevant and putting it all in one place. I was like, that just seems so needed, so that you can go and look and see, when are people talking about the thing that I'm doing work in, so I can make sure that I'm in those conversations when they're happening. So that's one resource. We also have the HealthComm Toolbox, which is just like a compilation of all the different health communication related tools that I find online. So when I see something that I'm like, oh, this is a good resource, it could be plain language guides and tools for like, reading. Is your website readable? What's the reading level of the text on your site? Or if it's a color contrast tool, so you can make sure your images are 508 compliant and that people can actually read the text on the images. Or if it's resources for using social media, whether it's like toolkits and guides, or I just wanted to put all those resources in one place, so that people could find them more easily, find what they're looking for, and continue on, creating the resources and putting out the information and data that they have in the most engaging and creative way possible. So yeah, we just offer a bunch of resources through our library. We've also launched an academy, and right now we have some free digital downloads there. There's a course in the works where I'm going to just be breaking down all of the things I think you need to know. That question you asked about how do people engage effectively, that is what's going to be broken down in the course. I'm going to take you through a whole list, hit the high level stuff, so that folks who are doing this work can know what they need to know to be able to do the best that they can do in communicating and sharing their messages, the information, data, so on and so forth, and connecting, engaging with the communities they serve. So there's the academy, we have the library, we have our productions, we have a YouTube channel, which I'm really hoping in the next year to really expand and do more video content around health communication, tips we're seeing, what's the best practices and communicating about XYZ, because so much research comes out, but I don't think we're always quick about incorporating what the data is telling us into how we're messaging. So trying to be able to pull that information for people and put it in one place where it's easy to find. That's kind of the goal. Outside of like the work we do with our clients, that's really something that was important to me, was putting those resources together and as much as we can helping all the agencies out there and organizations, that even those that aren't our clients, to be able to do the best that they can do, because health communication saves lives.
Love it, love it. And who would your ideal client be?
I mean, in my wildest dreams, I would love to be working with, showrunners in LA. There's so many TV shows that have the eyes of people that we could be working strategically with those writers to get like evidence-based crafted messages into. There are a lot of shows that have like health storylines, but those aren't necessarily intentionally structured to change behavior and promote healthy things. It's just a part of the story, and they're weaving it to help the character in that story develop. I would love for us to be doing like public health product placement, the way, you know, in the early 2000s you couldn't watch a show without seeing a Surface Pro, the character pulling it up and using it in the, you know, or when they pick up the soda can and it's Pepsi, or, you know, like I would love to be doing that. I think public health we could be really intentional and do like that type of product placement, but with health related messages. That could be next level. And until I get there, I've been working with a couple local health departments, really helping them build infrastructure for communication, helping them come up with, even if it's just like a standard operating procedure and some guidelines, so that anybody that comes into the organization can do the communication work and do it well. I'd love to be working with like museums. I'm really going to try to work with the Smithsonian. I'm going to put that out there. At some point in my life, I'm going to be working with the Smithsonian on some exhibits around public health related issues, because somebody writes all of the things you see in those exhibits. They title everything, they write all the display cards, they construct the story that you're walking through while you go through. I would love to be doing like work like that too. So yeah, Smithsonian, hit me up. Yeah, that would be awesome. But I'm really just happy to work with anybody, even if it's someone who's just like, if you're more on the healthcare side of things, but you just opened your own practice, and you're really looking to like reach out into your local community and build your clientele for the services that you're providing. Any of that work is all relevant, because that's a huge piece that we also don't talk about a lot, is that like public health and healthcare really do need to be working together. So anything that I can do to help in getting folks into and accessing services that they need, and also helping providers communicate better with their patients, like, oh yeah, I'm there for that too. So.
And you heard it here first when you see Monique working at the Smithsonian, telling the stories of public health and other health related stories. So that's dope. I like the vision, and definitely look forward to seeing all the work that you do and all your path to getting to the Smithsonian, or to even doper health communications type work.
Thank you.
So yes. And I will have your website and some of those other things linked below for anyone that's interested. So definitely check that out. Connect with Monique, connect with Let's Talk Public Health. So moving on to the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Keep an open mind. Your career path will likely change. It will. You'll go in there thinking one thing, and then you'll take a couple courses about something. You're like, actually, nutrition's where I want to be, or environmental's where I'm going to go. So yeah, just keep an open mind.
Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
I would say before you start your own thing, see what's out there. If you do not need to build something from scratch, don't do it. I mean, you can, but why? If there's something out there that's a good fit and it speaks to you, like find where that is. If not, then build it for yourself.
Number 3, what's something you're working on improving in your life right now?
I put in my notes appreciation. And I'm going to stick with that one. I don't think we are good about appreciating things until we're gone. And just like taking time to stop and smell the roses before they wilt and wither, and to show gratitude and just appreciate where you are. Yeah, I think that's super important. And I am working actively to do that.
Number 4, professionally, do you recommend anything?
LinkedIn. LinkedIn, people. LinkedIn is where it's happening. There's so much growth of healthcare and public health related professionals that are joining and being active on LinkedIn. Do not snooze on that. Get on there, be active, connect.
And number 5, if there was one piece of advice you'd give to your younger self, what would it be?
Don't be so scared all the time. Embrace fear. Fear is good. Fear is how you know that you are alive and that you're doing something that's probably going to be worthwhile to you, and to just learn to be able to sit with fear and push through it and forge your path forward.
Love it. Well, Monique, it was a truly my pleasure to hop on the podcast and hear more about your story, listen to more about the work that you do. So I'm really glad, and this is definitely not the last time that we will collaborate for sure.
Oh yeah, definitely.
Awesome. Well, housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a 5-star review and share it with a friend who gets some value from the conversation. We'll see you all next week. Peace, everyone.